In continuation with our pregnancy care series, I will be discussing ectopic pregnancy. Ectopic pregnancy. What ectopic pregnancy is, the causes, the symptoms, diagnosis, and management method. Hello and welcome once again aboard JulieCity. How are you keeping? I hope you're keeping well and safe. As usual, I'm always excited to be here and I'm glad you are here. Thank you for clicking to watch today's video. This is not a very cheerful topic. However, people do experience it. And if you've been following me, my motto is knowledge is power. And so when we are aware and well informed about a condition or a situation, we are better informed and empowered to make the right decision when necessary. So sit down, relax, and let's get started. Generally, pregnancy starts when the male sperm and the female egg meets. This happens somewhere around the fallopian tube, and the fallopian tube could be regarded as a passage to the womb. From the vaginal area to the womb, there's a travel to be made, and the fallopian tube acts as that travel passage. The fallopian tube is meant to be the corridor where the newfound lovers, the sperm and the egg, meet together and travel to their abode or their resting place, which is meant to be the womb or the uterus. However, in the case of ectopic pregnancy, this journey is cancelled or disrupted for unusual reasons, which I'll be discussing. These newfound lovers, the sperm and the egg that are fused together, decide not to make that journey, rather to settle at the tube or train station. There are a few reasons why these newfound lovers, the egg and the sperm that are fused together, will refuse to make this ultimate journey to their most comfortable abode, which is the womb. This could be as a result of damage to the fallopian tube from previous infection or other medical condition. It could be as a result of hormonal imbalance or as a result of other medical concerns around that specific person's reproductive system. Symptoms of ectopic pregnancy can start from very mild to very severe. And ironically, these symptoms can be camouflaged as it feels like general symptoms of any other regular pregnancy. Research says that some people might not even experience anything until maybe they go for their routine 8 weeks or 12-week scan, and the scan discovers that actually baby is not based in the womb but somewhere else. Like I said, the essence of sharing this information is not usually to scare anyone, but to keep you informed to avoid stories that touch. As I will list on the screen, this will include mild pain in the abdomen or cramping, light bleeding, pain at the tip of the shoulder, some bloating or windy pain, heavy bleeding, which can indicate a more severe stage of ectopic pregnancy. Either way, if you notice anything at all that makes you worry or that is different from your pregnancy or even your health in general, speak to your medical practitioner immediately. And if it is a case of severe bleeding, of course, call the emergency services 999 112, depending on what country you are calling from. The most severe symptom of ectopic pregnancy is the rupture of the fallopian tube. This is a medical emergency. Don't wait to be seen by the doctor. See your doctor immediately to avoid stories that touch. That fallopian tube is not designed to accommodate a full pregnancy. And the longest research says that this pregnancy might last in the fallopian tube before causing severe damage is somewhere around 14 weeks. And what follows next is that rupture, which is severe. If one is having any of these symptoms or feeling anything different, like I said, if you contact your midwife will trigger a scan, or you contact your doctor, they will trigger an ultrasound of the pregnancy, and ultrasound will definitely confirm that Baby is not in the womb, but somewhere else. Other means of diagnosis could be blood test, pregnancy test. Of course, if you're pregnant and the scan is not showing the baby in the womb, then most likely it's an ectopic pregnancy. When this is confirmed by your medical practitioner, there are a few options. Depending on the symptoms, it might be a case of let's wait and watch if it is a mild symptom, but there will be close monitoring. If it is moderate, then what happens will be a case of medical management, which is where a medication is given to the woman to stop the growth of pregnancy to avoid rupturing. It can also be a case of surgery that will dislodge the pregnancy and save the fallopian tube and all the consequences that will arise if that fallopian tube ruptures. Now, in the case of very severe, the rupturing of the fallopian tube, then that will be emergency surgery to save the woman's life and try and salvage what is left of the fallopian tube. With ectopic pregnancy, the focus is trying to save the pregnant woman and what is left of her reproductive health. Unfortunately, the pregnancy cannot progress, and that can come with a whole lot of emotional trauma for the woman concerned. So it's important for the woman to seek support as required from family, loved ones, friends, and if professional counseling is needed, then she should not hesitate to do so. I hope you have found this video useful. I will stop here today, and until I see you next time, don't forget, your health is your wealth. Remember to like this video if you found it useful, subscribe if you have not, leave a comment, educate us more in the comment section. I really appreciate that. And share so that others will learn from this video. Till I see you next time, bye-bye. Don't forget to click on these videos popping up. I'm sure you'll find them insightful. Bye.